Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. In the former case, this results to diabetes type 1, while in the latter, one gets diabetes type 2. 6 months ago, 11-year-old Juanita Mutindi was diagnosed with type 1 diabetes. Here, there is a destruction of insulin-producing cells of the pancreas. The subsequent lack of insulin leads to increased blood and urine glucose. The classical symptoms of type 1 diabetes include frequent urination, increased thirst, increased hunger, and weight loss. So, who's at risk of diabetes type 1?
All of us are potentially diabetic, and therefore you live your life knowing that you are living it to protect yourself from diabetes.
Like in Juanita's case, type 1 diabetes is characterized by deficient insulin production and requires daily administration of insulin. Insulin absorbs glucose from body cells. Glucose, on the other hand, is stored in the liver and muscle cells as glycogen, stopping the body from using up the fat as a source of energy. Although a large number of diabetes type 1 patients become so during childhood, it can also develop after the age of 18. However, developing type 1 diabetes after the age of 40 is extremely rare. The majority of people who develop type 1 diabetes are of normal weight and otherwise healthy, leading normal, active lives. Diagnosis of diabetes type 1 is an easy process that can be done by any adult from home. Clinical blood and urine tests can also be done to find out if one has diabetes type 1.
But these days we want to diagnose diabetes before we get to these overt symptoms, because by the time somebody has major symptoms of diabetes, the disease has already caused damage to the body.
People with type 1 diabetes have to watch what they eat. Foods that are low in fat, salt, and have no or very little added sugar are ideal. Such people should also consume foods that have complex carbohydrates rather than fast carbohydrates, as well as fruits and vegetables. Portion size is also important to maintain a healthy body weight and maintain low cholesterol levels.
Our children are taking these excess sugars in addition to an adequate diet. So we're actually overeating sugar. So we must focus on how much sugar and starches our children are taking.
A person with type 1 diabetes has 2 to 4 times higher risk of developing heart disease, stroke, high blood pressure, kidney failure, gum disease and nerve damage compared to someone who does not have any type of diabetes. But the good news is treatment is available and effective, helping prevent these complications from happening. According to medical experts, physical activity can help regulate blood sugar levels. However, it helps to check your blood sugar level to help you adapt your meal plans and insulin doses. In a nutshell, the 4 pillars of diabetes management are insulin, food, exercise and glucose testing. Balancing your glucose levels with the first 3 is your daily challenge. Testing your blood regularly is the only sure way of knowing how you're doing. The good news is you can learn to manage type 1 diabetes and in turn reduce the risk of long-term health complications. Zein Noor reporting for Sunday.